It's a familiar image. Aging portrayed with walking frames, hunched postures, and limited mobility. Sometimes even wheelchairs. As we move through our 30s, 40s, 50s and beyond, many of us begin to notice stiff joints, sore muscles, and that creaky feeling when getting up from the sofa. We tend to accept it as just part of getting older. Aches and pains? Inevitable, right? Maybe you've seen older relatives gradually lose their strength, balance, or independence. But do we really understand why our bodies change, or whether it has to be this way? Is declining mobility, poor posture, and increased risk of injury truly unavoidable? Or can we do more to protect our bones, joints, and muscles? The global health industry spends billions trying to tackle the symptoms caused by worsening bones, muscles, and joints. But what if we focused more on improving our understanding and on prevention? Welcome to Joint Care, a podcast exploring musculoskeletal health through expert insight, clinical evidence, and the real experiences of people, especially women, living with osteoporosis. We're here to spotlight the how and the why of bone and muscle health, and to share practical ways to stay mobile, strong, and independent as we age. This is your front row seat to knowledge that empowers you to take charge of your body. My name is Kemi, and I am your host. I am a GP. Prior to this, I was an orthopedic surgeon in training. I saw firsthand the impact of osteoporosis with fractures, the severe pain and loss of function caused, and the potential to change the course of one's life. I'm joined today by Gemma, an experienced specialist Pilates instructor with engaging practice, guiding women with osteoporosis to exercise with confidence. I came across her platform on Instagram and I was blown away by how effective, simple, easy to follow her content was. And I just had to reach out. So I'm incredibly honored that she agreed to come on this podcast. And I think you'll be enriched by what we discussed today. So thank you, Gemma.
Thank you, Kemi, for inviting me. I'm so excited to be here.
We're both in the space of bone health. And I guess a good place to start will be to understand your journey into looking specifically after osteoporosis. What's your background and what interests you in bone health?
Well, I originally trained as a dancer. That's my background in movement. So I'd always moved, and I danced professionally for 10 years. And my dance career kind of came to an abrupt stop at COVID. I was just turned 30, which is not old, but for a dancer, it's like you're getting there. I shouldn't say that. Many people will probably be like, what? But I kind of had a choice to make whether I would carry on with dancing or do something different. And I had trained as a Pilates instructor maybe 2017, just on the mat. I knew this is what I want to do afterwards. So I went to study with Alan Herdman in London. He specializes in Pilates, so preparing the body before you exercise, and looking at rehabilitation, so helping clients with injuries, chronic pain. It was really what I wanted to do, was work with dancers. And then when I left my training after COVID as well, I think people were really craving face-to-face interaction. And I started working with clients pre and post hip hop, which was so interesting and fascinating. Frozen shoulders, chronic back pain, lots and lots of different injuries. And then I was asked to take over a bone health class. And at first I was like, oh my God, I cannot do this, because even the training that I had, they were just kind of like, be really, really careful with these clients. You have to take extra care. And then there's a list of contraindications, like don't bend, don't stretch, don't twist, don't lift up anything heavy. And I was like, oh my God, well, how can I teach them Pilates? Because that is Pilates. So the woman who I took over from, she's super nice and she guided me. But I felt that I had a duty to my clients and the women who were coming into that class to educate myself. So I went and I learned how to read a research paper, and I started looking outside of Pilates, because I actually think in our industry, sometimes people get very focused, like this is Pilates and we only do Pilates. And I actually think the best specialists are people that look beyond what they actually do And it just really enlightened me. It made me realize I had to change what I was teaching people. So I just kind of adapted my program, and the ladies saw such great results. Everybody really loved the class. Everybody felt confident. Everybody started to do things that they maybe weren't doing before. And then I just realized that those were the clients I really like to work with. And I just decided to carry on really. And here we are, a few years later.
I think that's amazing that you went from a place of lacking confidence and not being quite sure, and you took the steps to actually educate yourself and inform yourself. And in doing that, you've transferred that to people who equally were lacking confidence in their bodies, to be able to move, and probably you've transformed lives. I dare say, in
I
how
hope.
you encourage them to move and live again.
I think, honestly, from my experience, that's like the number one thing, giving women that confidence back, because people are so scared and frightened. And it is scary getting that DEXA scan result or being told, not everybody has a doctor with great bedside manner sometimes. So when they're told this very,
Mm.
like, yeah, life impacting news, it really shakes people.
Mhm.
And also I think that the actual exercise recommendations are really not clear. Even
Mm.
from the specialists, there's not really very clear recommendations.
That's very true. What would you say are the core values of your practice?
I definitely think it's about empowering women to feel confident in their bodies again. So that's my number one thing. And also just educating them in what the risks are, because there is a responsibility. You have to tell people, okay, these these are the risks, but also just encouraging people to move, because that happens is people get their diagnosis, they're terrified, and they actually stop moving, which is the number one thing. So it's really about re-educating women and
Mm.
giving them as much movement options as possible, because I actually think most of the guidelines is quite restrictive, and
Mhm.
my aim is to be like, okay, no, this is what we can do. We're not going to focus on what we can't do. We're going to
Yeah.
focus on what we can.
It's quite sad, isn't it, that that shock is counterproductive to what is actually needed in osteoporosis, which is loading that bone, stimulating new bone formation. Um, you mentioned some risks that you will normally tell your clients about. What are the main risks you would say?
Well, the main risk is things like forward flexion, and especially under load. So, that like constantly bending forward. Um, it's a tricky one because obviously these fractures happen, like these spinal fractures, compression fractures, that they happen after like continuous movement. So what we don't want to do is get people lifting very heavy things in that position. But it's like a catch-22, because you can't live your daily life without forward flexion. You can't brush
Mhm.
your teeth, you can't put on your shoes, and
Mm.
people aren't robots. So really the main thing I try to educate people is a position that if you are doing something continuous and just thinking about their posture,
Yeah, yeah.
day-to-day basis. I also apply the same for twisting. So like forward bending and twisting. You
Mhm.
know, we are going to do it in life, but
Mhm.
with a weight, with something heavy in your hand, there are options.
Mm.
And then really, there's no one size fits all. It really does depend on the client, because someone who's in their 60s who's not very mobile and has a compression fracture, their needs and their risks are going to be very different to somebody who's 55, may never, because some people, they never have a fracture in their lifetime, but they've been diagnosed, but are very fit and strong. So you can't really apply the same factors to them, because that person who's 55 is very fit. Maybe they weightlift, maybe they run. Like, you don't want to take movement options away from them. You have to educate them, but you want to encourage them to keep training. So, yeah, it is a mix.
It's fascinating to hear you talk because it just almost makes what you do so much more complicated because you're not just teaching a class, you're having to tailor it. Okay, that person's had a fracture before and that person's got a diagnosis, but actually they've got a good baseline, so we can do a bit more. And you really have to engage with the clients that you're working with. And so I guess what I would ask you is in a an episode called Core Values. I have to come to the core, and I have to say, how does Pilates actually promote core strength and flexibility?
So Pilates, the original, it's built like a system to work your body in all directions. And basically, for me, I always describe it that you're able to strengthen and isolate your core, so your trunk, and you can move your limbs freely, right? When your center's strong, you have flexibility, mobility, and movement. Um, it's a little bit different. We had to adapt it. So maybe some people would say I'm not really teaching Pilates anymore because had to change so much of it, because a lot of Pilates is about spinal flexibility and spinal mobility. And a lot of that we have to adapt because we're not
Mm,
doing twisty movements. But what is important is that you understand that connection in your center and that you
mhm,
could be
mhm,
strong, especially if you've got instability in your spine. You
mm,
need the support more than
mm,
ever. So
mhm,
something like Pilates is such a great base. You have to change, had to adapt it. But what it does is it teaches people how to listen to their body, so mind body connection,
mhm,
which I think is crucial, because when you've lost that trust in your body, or you've lost that confidence, learning how to listen to how you feel and what you can do is really important. And that's one thing that uh, Pilates has really helped me get across to people. And it's
mhm,
not too scary. You know,
mm,
Pilates is reasonably gentle. It is a low impact form of exercise. So it's approachable for a lot
mm.
of well.
Yeah. Is it easy to track improvement over time? Like, are there certain steps that you say, okay, when you start with me, this is what we're going to work at, and then we want you to be able to do this by this, not necessarily in any particular time frame, but is there the holy grail you're working towards, like being able to plank for 30 minutes? Not saying that's a thing. What are the markers of improvement of strength and within Pilates?
Well, that's the thing that's also very difficult, because in a fitness setting, it's very easy to measure results, because, like, say someone wants to come and weight train and they say, oh, we start with 5 kilograms. Within 12 weeks, we're lifting 8 kilograms. You can measure those metrics much easier. Whereas in Pilates, you can't really, because you're often doing different things. We don't have the same metrics. I've had to change it to kind of build a program. So for
Mhm,
me, I usually like to start to work with clients for 12 weeks.
mhm,
And in that, I have a framework that I teach called SPICE. And it's a way of clients getting to understand exactly what they need for bone health. So strength, posture, impact, core, and equilibrium or balance. They need these elements. The Royal Osteoporosis Society have a really great tagline too, called strong, steady, straight. And it's basically need to look at the client and see where they're at. If somebody needs strength, does somebody need more posture work and upright? Or does someone need to work on their balance? Like, what are their
mhm,
big concerns?
mm.
And for me, I use those five exercise types to make sure that clients are doing those things. So that's usually how we'll apply. Or you set a goal, a personal goal. And for a lot of people, when people first come in, they'll say, oh, I want to be more flexible, or oh, I want to, I want to be.
Refit cupboard.
But that's it, Kemi, exactly, because originally they won't say that to you. But then you start to talk to people and they'll say, actually, my daughter's going to have a baby next year, or like in 6 months, and I want to be fit and ready, or my son is getting married. It's usually those sorts of
Yeah.
things you find out from people, which I'm sure when you talk with.
Yeah, and that's life, isn't it? Because osteoporosis isn't just a condition. It, as you started off saying, can instill fear into someone who was otherwise just living life normally. And yes, they had aches and pains, or perhaps they just broke a bone and they just thought it's a broken bone, and then they're told actually you're at risk of breaking more bones. That must really put people in a vulnerable place when they come to you. Not being too anatomical, but what would you say are the most important parts of the core? When we actually talk about the core, for you, what does that mean?
So for me, I think this is something that's debated by a lot of people actually. For me, when I think of the core, I think of all the abdominal muscles that run, from the spine all the way to the front of the stomach. From
Like
that
a
run,
corset.
yes, like a corset from the base of the rib cage to the top of the pelvis. And
Mhm,
obviously, you've got lots of layers in there. You've got four sets of abdominals,
mhm,
transverse, two sets of oblique, and then your rectus abdominis.
mhm,
You've also got all the muscles in that attach into the lumbar spine. And then I also consider the diaphragm and the pelvic floor to
mm,
be part of it, because both of those systems respond to every type of movement that you do. And
mhm,
pelvic floor issues are another thing that when I'm working with women struggle with
mm.
uh, as well. I always describe it like a Coke can. I always say to people, we want to have like strong supported Coke can. We don't want to like
Push it in. Yeah.
want it to collapse. We want it to be strong and solid,
Yeah.
like the trunk of a tree. So
That's a great analogy. I like that. I mean, in orthopedics, the focus is primarily on the limbs, and the spine gets a bit of a look in as well. But is predominantly the bone and the ligaments. And actually, in my own journey of learning, I was surprised to find out that the pelvic floor was a part of the core, and that in itself is a whole other area of problems for women as we get older. So the work that you do is not only having benefits in terms of mobility and balance and confidence, it's actually helping them to retain dignity in an area that costs people dignity as they get older.
definitely. And there's some really wonderful pelvic health specialists and physios. And actually, I trained with a woman called Louise Field, who does adore your pelvic floor. She is amazing. But for me, it actually wasn't even something that I had considered really, because I'm a woman in her 30s. So for me, it's not a problem that I have to deal with yet. Hopefully never. And actually, I was doing a class and I had impact in my class. So, stamping, stomping. And the woman, she came up to me at the end and she said, I really struggled with this. And I feel it's very difficult for me to do impact training because, of her pelvic floor issues, and really like shone a light on it. So then I went and did some more education so that I can understand that too. Um, because I didn't realize either every single movement that we do, like, squats, lunges, it all has that internal effect on the pelvic floor. So it was very enlightening for me as well. And I'm glad actually that woman actually said something to me, because I think a lot of women are scared to, or don't feel that they can.
And I think that's so important that you've created a space where people not only feel confident to start moving again, but they also feel confident to be open in that vulnerability to say, well, actually, this is happening. Do you have many men in your classes?
No, I don't actually have any men, which I think it's mainly because, well, I know that men are also struggling with osteoporosis too. I think it's 1 in 5 men, I think,
Mhm.
will suffer from an osteoporotic fracture. But I think because I mainly work on Instagram and I tailor most of my content around women, then I don't have any men. But if there's any men listening and they want to come and join, they're more than welcome.
Yeah. This is the space you need to be, for sure. What do you think the long-term benefits are? If you were pitching your service to someone and they said, okay, I just want to get strong now and then I'll be fine. What do you think the long-term benefits are to maintaining and engaging in continued work on flexibility and strength? And actually, um, that concept, flexibility and strength, is an important one because there are certain conditions where people are hypermobile, for instance. That often goes with flexibility in weakness.
Mhm.
How do the two differ, and what are the long-term benefits of continuing to build and maintain strength? And what happens if you don't do that?
Well, now I think strength is really having its moment and encouraging people to lift weights, especially women, whereas before it wasn't really very fashionable for women to lift weights. women do cardio and men stay by the weight rack. Now it's completely changed, and it is everything, because muscle is longevity. There's lots of studies now to say that the more muscle mass you have, the better your metabolic health is, the longer that you're going to live. But it's also really for independence, because as we age, if you don't continue to move your body, you can't get up from that chair, you can't play with your grandkids, you can't go for a walk. That's what it comes down to. It's longevity. Yes, maybe you have to work hard for an hour or 45 minutes a couple times a week, but if it's the difference between having a life that you can live rather than a life that's sedentary,
Mhm.
it's everything, I think. But that's easier said than done, because it's not easy for everyone. And
Mm.
I think now the problem that we have is that, for example, my parents' generation, this sort of preventative medicine or preventative interventions weren't a thing. If you got sick, you go to the doctor and it's curative, it's not preventative. Now I think there's much more push towards preventative options.
I mean, that's a really important point you're raising, because, of course, life expectancy is increased. So perhaps in your parents' generation, they retired at what, 50, 55, and then they were considered OAP at 60, 65. You wouldn't dare refer to someone in their 60s now as an OAP. They're young. And you're shocked if you hear of someone in their 60s passing away, because, that's a young age.
Is
Um,
yeah, yeah.
so certainly the longevity nowadays in current climate of how long we're living is so much more important. How do you appeal to people who are in the younger age group who perhaps are at risk? Is there any work you do to try and target or encourage those? Because I think a lot of what I'm doing, ideally, they're fantastic people like you who are helping people who already have that diagnosis. But there are many people walking around who are already osteopenic, who are at risk of osteoporosis, either through just being female, their age, and the fact that, they're perimenopausal, or they have a strong family history, or they have other health conditions and they've used certain medications like steroids, medical steroids that is, and they're at high risk. But we often, they're almost a lost tribe, and we only get to know about them, unfortunately, when they have a fracture. Is there any way in which we can reach those people?
I think as a woman in particular, we have to educate ourselves. Now, of course, menopause is like much the conversation between menopause and now perimenopause. Actually, I see a lot more content geared around perimenopause. The thing is that we will have to deal with bone density issues as we age. Bone density does decline every year. I think it starts, 35 is your peak bone mass, and then it will start to decrease.
Probably a bit younger, actually.
So,
Yeah.
something as simple as strength training or exercising regularly or impact training, especially for women, plyometrics, jumping, weight training, can help to stop it or to slow bone loss, because going through menopause and those hormonal changes has a big impact. And also, I think we don't think about bone density when we're younger, but there are lots of people who are younger. I've spoken with a couple of people online recently, young women in their 20s who are struggling because of eating disorders. They've
Yeah.
been diagnosed with an eating disorder and now they're struggling with bone loss. And actually, you can change your bone density at any age. And some people, I'm sure you know more than anyone, Kemi, but some people do need medical intervention depending on the severity. But if you're young, then you have so much opportunity and time to have
Mm.
a positive impact.
Mm.
It is just being aware, I think, and educating yourself as a woman.
Yeah, no, absolutely. And of course, we mustn't forget that those medical interventions come with risks and side effects. And actually, after some time, they can have the converse effect of making your bone hard and brittle. So you get a different kind of break as opposed to the sort of soft, easy to break bone. So that definitely adds more weight to the lifestyle interventions and the bone loading. So yeah, that's really, really important. Another question I have for you: are there situations where core strengthening isn't advised? For instance, if you've had a baby, or you have a hernia, Those are just two examples. I don't know if you have any others. And what do you advise in those situations?
Very good question. So, core strengthening, anybody can do, but obviously, certain people and certain situations are going to change how you train the core. So, for example, and I mean, there are plenty of other instructors who work pre and postnatal, but obviously, that kind of strengthening is going to be very different. I think actually there's a lot of research to say that they're changing how you train the core. For example, before it was said you're not supposed to do any sort of crunchies or anything with diastasis rectus, when the
Mhm,
abdominal
mhm,
walls separate. But
mhm.
I think now there's a lot of evidence to say that's changing.
Okay.
Um, Also, I think when someone has a hernia, for example, you have to be careful with how you train them. It's more the positions that you put them in. Traditional core exercises would just be, for example, like ups,
Yeah.
which these are good exercises, but actually core strength comes from stability. So when I'm training clients with osteoporosis, for example, and this would go the same if someone had some sort of hernia, and we got that traditional doming when they sat
Yeah.
up.
Yeah.
It's because of that pressure, that internal pressure. So
Mhm,
doing things where you're keeping their spine and their abdominals in a nice solid position and putting them in unstable positions, for example, like using a ball
mhm,
to train the core, or even standing exercises. Sometimes you hold a spring or you
mhm.
hold weight in place. You just have to be a little bit more clever and
Yeah.
inventive about how you train it.
Mhm.
But yeah, there's definitely different techniques. But when it comes to pre and postnatal, that's definitely not my
Yeah. Yeah.
bag.
And
But
I think
amazing people out there who do specialize.
this is why people like you are so valuable, because really you're not just gonna wing it on your own. You're gonna go to someone who really knows what they're talking about and who can guide you and who's gonna have your interests enough to say, well, actually, you're not ready for that, or actually, I think you might need to consider this. Um, I'm an avid watcher of your videos, and I've seen one or two where you're doing side planks. With those, obviously they're working the lateral obliques and those sort of muscle groups. Um, when you do any muscle work, you need balance, right? So how do you match your exercises?
No, it's a good question. And actually, Pilates is about creating balance in the body. We want to try and create symbiosis. There we go.
Mhm.
There's a fancy
Nice,
word.
nice. I like it.
I always train one side and the other. It's all about creativity and having a bit of fluidity. So a class should be fun and
Yeah.
challenging. Exercise is hard, and
Mhm,
sometimes if something is difficult and you're not enjoying yourself, that client's never going to come back.
mhm.
So yeah, I try and like entertain a little bit. Maybe that's where my dancer still lies in me. Try to make it fun and inventive, for my clients.
And you know what? Talking about making it fun, I have to mention the fact that you have, at the moment, the most amazing offer. And I don't have osteoporosis, but honestly, you may be seeing me very soon. Tell us about this retreat that you've got going on, because it looks absolutely beautiful. Have wine in the sunset and talk about Pilates.
Pilates bones.
Yeah.
Uh, no, so when I moved here, actually, I met my best friend, and she used to work in the event.
I'm really sorry to interrupt you. You said moved here. I'm not sure whether you spoke earlier about where you actually are. So tell us where you are.
Yes, well, I'm now based in the south of France, so I'm about 20 minutes from Cannes and about 30 minutes from Nice.
Wow.
I
Not
know.
jealous. Not jealous at all.
Visit now. Have you
Mm,
excuse to come?
mm,
And I moved here 2.5 years ago with my husband. So when I moved here, and this is another reason why I kind of went online, because obviously coming here, I couldn't really speak any French. And I was like, how am I going to teach Pilates? I can't teach French. So that's another reason I took my business online. And I didn't expect it to kind of take off as it did. Um, when I met my best friend here, she's French, but her English is incredible. She used to work in events and she was like super burned out. It's such a fast paced industry and she wanted to leave her job. And we kind of joked. We were like, oh, it would be such a good pairing, to do a retreat because we're here in the south of France and I'm the fitness and you're the events. And
Wow.
we created a company this year called Eclore, one retreat, which means to bloom or like to hatch in French, which is
Gosh. You need a section in that retreat for mothers escaping life.
but you know what? The goal it actually is to do more. This was just our first year, kind of like first foray, but we wanted to do themed retreats.
Mm.
So okay, maybe we'll make the
Ooh,
next
yeah. I want to be on your mailing list. I want to know when you got that one going for sure. I mean, honestly, the thought of doing Pilates, strengthening, resting, meditating, in a beautiful setting. I mean, who would not kill for that?
yeah.
It's just organization and like, making sure the house doesn't fall down when you're gone for most women, I think.
And
I
especially
think,
what, four, right? Four people
well,
to
I think I think often in this stage of life, women in their 30s like yourself or 40s like me, we are often in the peak hub of life activity, whether it's career, whether it's family, whether it's children, relationships, whatever it is, there's a lot going on. And often we are last in that pecking order. And I think actually giving women a space. I'm not saying your retreat is just for women, because I'm sure, I don't know, but it may be that men are welcome. It may be that you have themed events for men as well. But I think that's why there's so much more community as we get older, because when we're younger, we're just having fun and carefree and no responsibilities. But as we get older, we start to find that common thread that just, shared experiences and that's so important.
Yeah, well, I agree. And this is another reason why I think this is important because it's a chance for other women to meet other women going through the same experience as them. And obviously, we're going to do lovely, nice things. We'll be in Provence. So the goal is to enjoy Provence. But I wanted to working on some special workshops, to help women on mindset, to help women on advocation, because that's another thing as well. We touched on this before, about how when you go to see your GP, there's not a lot of time. So if you as a woman know what you have to say, what you want to do, and you've got things written down, you know which questions to ask, you know, it also empowers you, I think. I want to build some workshops and we'll do some special movement workshops on posture and talk about a spice. I always feel so silly when I say this, but like
So
it really, really important.
tell us quickly about spice and how that unfolds in your practice.
In my practice, we're talking spice, so strength, posture, impact, core, and equilibrium balance. In order to really care for your bone health, you need these elements. You need to be strong, you need to weight lift, you need to resistance train, you need to have good posture, right? We all suffer from bad posture, but in particular, you can increase your fracture risk if you're not looking after it. Impact, which is that scary one, but there's so much great research going on now to encourage women, to jump, to boost, to load our bones. Core, as we touched on before, because we need to support our center so we can be strong and steady. And then finally, balance, because fractures don't happen usually in very extreme situations, but normally it's because somebody trips or they fall, slip on something. It's day-to-day actions and accidents. So I really encourage that. So I have a weekly group Zoom classes, and each week we move through each of these. One class
Spice.
strength. Yeah, we'll do strength, we'll do posture, and then once we've gone through all three, I combine all of them and we go through it together. And I think it's a really clear way for women. And it also means that because I record everything and I put it on my platform, that if when they're practicing at home, they're like, oh, today I want to work on my posture, or I don't feel like my balance is good. They can pick
Mm.
choose what they need.
Mhm.
And I think it's a good way for people to understand.
So are people who don't have osteoporosis welcome to your classes?
Of course, of course. They're more driven to bone health, but people are always welcome
Yeah.
to come and move their body and just have fun. Because that's the thing, like I said before, it should be fun.
Yeah, of course. And how can one reach you or join one of your classes if they wanted to?
Yes, you can find me on Instagram at Osteoporosis Pilates, or you can find my website, which is super easy, Osteoporosis Pilates. Oof, it's a mouthful.com.
Hmm.
And I do 2 Zoom classes a week. So I do one on Monday morning at 10 a.m. and I do one Thursday evening at 5 p.m. These are UK times.
Okay, that was going to be my next question. And we're talking GMT because we've had to really coordinate our timings. We sort of, well, mostly my fault, but we're like, hang on, am I
Right,
behind or
right.
ahead?
UK times because we have a mixture of ladies, some English, some Irish, some American, some Canadian. So yeah, so 10 a.m. Mondays and 5 p.m. Thursdays.
Right.
Then I've got a platform with videos and things
Mhm.
you can do at home as well.
Excellent. Well, that is just wonderful. And I'm so privileged that you responded to my inquiries and you made it here.
I'm always like, me?
Well, hopefully this is the first of many. It's been amazing and really enlightening and inspiring as well. Hopefully this will reach the right people, and will be shared with people who are going to benefit. And thank you once again.
No, thank you for having me, Kimmy. I love what you do. So just keep going. It's so important.
Thank you for joining us today on the Joint Care Podcast, your trusted source for reliable information on bone and muscle health. As a GP with over a decade of experience in orthopedic surgery, my passion is to provide you with accurate and practical advice to help you maintain your bone health and, in doing so, a quality of life which will help you to continue independent living long into the future. If you enjoyed this podcast, please share it with those who may benefit, leave a comment, and subscribe to join our community, and follow us on Instagram for more content.